Hello everybody, welcome to the video. So we're going to do a quick video today, talk a little bit about carpal tunnel. We've done some informative videos on carpal tunnel before. The biggest things to remember is, carpal tunnel is kind of a misnomer. We call it carpal tunnel syndrome. Really what we're talking about is median nerve entrapment. Carpal tunnel, the transverse carpal ligament is just one of the places that the median nerve can be entrapped, and that's your true carpal tunnel. But there's other places the median nerve can have some entrapment too, but a lot of times they get just kind of thrown into that carpal tunnel diagnosis as well. So what I got here, actually drew out the median nerve. I just want to show you some quick anatomy here, and I'm going to show you a couple places that we find it to be entrapped quite a bit. So obviously the carpal tunnel is starting up towards my neck, and it travels through the arm. Really, I wanted to focus from elbow down. So as that courses through our forearm, it crosses underneath the the transverse carpal ligament here, and then it splits out, and it really talks to these three fingers. Sometimes you'll get a little bit of sensation loss on this middle or the inside of this finger as well. So remember the symptoms here. It could be numbness, tingling, it could be pain, it could be weakness over time as well. Symptoms, true carpal tunnel symptoms are usually worse in the morning. People feel like they got to kind of shake out their hand a little bit. So another place that we find entrapment, and we've actually found more entrapment with the median nerve up at what's called the Pronator Teres muscle. So the Pronator Teres muscle, it actually runs from the inside of the elbow, and it runs kind of at a diagonal location towards the radius side of the forearm here. So in the job, it's called a pronator muscle. The job is to pronate. So when it shortens, it pronates or rolls in at the wrist. And if you guys think about this, you think about what we do during the day. We spend so much time pronated at the forearms rather than either, we consider this a neutral position here. So the opposite way would be supinated coming this way. So if we're always pronated, we're always going to have some muscle shortening there, and that can potentially compromise and cause some compression on that median nerve. So just like my kind of anatomy shows. So what I wanted to do is give you two quick exercises that we give to a lot of our patients that present with these type of issues. And I want to give one for each. There's several that we can give, but these are probably the ones that we give most often. So if we find a patient has a lot of irritation at that pronator teres muscle, then we call it an exercise. It's really more of a micro break because we want them to do this several times a day, but we just call it palms up. And all we want the patients to do is any time that their hands aren't really in use and they're getting a lot of these symptoms, then we just want their palms to be up towards the sky. And as you can see, when I do that, I'm in a supinated, which is opposite of pronated, position here, and that's going to allow some either neutral position or maybe even a little bit of lengthening sometimes of that pronator teres muscle. And a couple things, sometimes this might give instant relief, but over time this will allow some of the stretching they do for this muscle to kind of take hold because they're starting to get a little bit of opening up. Okay, so when they're at home, maybe just kind of hanging out watching TV, they can just kind of lay their hands flat on their lap, palms up. If they're in their car, rather than being up at 10 and 2, they can maybe drop them down this way as well. Again, they're going to be in that open position. So that's one exercise. The other one is going to address more of the transverse carpal ligament, which is your true carpal tunnel. Because this is a ligament, not that we can't stretch around this area, but really what ligaments like is more mobility as opposed to a static stretch and hold. So if the exercise that we give, it looks something like this. So we have them go palm on the wall. Okay, they'll be straight at the elbow, straight at the arm. They'll get about 90 degrees at the wrist here. And we want to make sure a couple things. We want to make sure, because the ligament runs from the bottom of the carpal, so you can kind of see where my thumb and finger here, that's kind of your distance of the ligament. We want to be able to make sure those points are on the wall. All we're going to do is have them take hold of underneath the thumb, still keeping that bottom carpal on the wall, and then they're just going to give some light mobility. Okay, so I bring it back, just a short hold, relax it, And I'm going to repeat that about 10 times. And we will have them do this. Most of the time it's going to be a twice a day, like most of our exercises. Sometimes they might have to do it more often if they're having true carpal tunnel symptoms. So those are the couple exercises that we recommend often for those type of symptoms. If you got any questions, please let us know. Otherwise, we'll see you next time.